friends, I'm Soham Bera, Senior Consultant Optometrist from India. Today I am going to tell you about common eye disorder. Please listen it very carefully. In this video I am going to tell you common eye disorder. As an eye specialist in Kolkata, I see many patients with common eye disorder that may or may not be serious. Also, people often will call me such as eye redness or swollen eyes warrants a visit to an eye doctor. This video will help you to learn the type of eye disorder you may have and what should be done about it. However, it is important to recognize that these guidelines are only an overview and definitely should not replace a consultation with your own eye specialist. Typically, common eye disorder can be broken down into major eye symptoms, making it easier to sort them out and come up with specific guidelines. Major categories include redness, itching, swelling, burning, trauma, pain, blur, decreased in vision, spots, flashes and flutters. If your eyes are red and irritated. Red and bloodshot eyes have many causes, including infection, inflammation, allergy, broken blood vessels and trauma. If the white of your eyes, means sclera, white part of your eyes, looks red or pink, you might have one of the following conditions. Pink eye. If you have kids, you almost certainly knows about an eye infection known as pink eye. Adult can get it too. If the redness is a form of pink eye known as a conjunctivitis, you also will have symptoms such as itching, burning, stinging, eye discharge, swelling, watering, or a combination of all the above. Some form of pink eye are contagious and some are not. Allergic conjunctivitis, for example, is not contagious, but viral and bacterial form of pink eye are contagious. So it's best to see your eye specialist or family physician for diagnosis and possible treatment. Quick tips regarding this. Until you know more about what may be causing your problem, you should avoid rubbing your eyes. Make sure you wash your hand often. For relief, use cool, wet compress on the outside of your closed eye. Come to eye allergies. Allergies can be seasonal, spring and fall, or they can happen when something is irritating, allergen, invade your eyes, like cat dander or fumes. Symptoms of eye allergy include itchy eye and red, watery and puffy eyes. How your eyes are affected may depend on the time of year and the type of plants you have in the area where you live. But many people can also have year-round allergies because of dust, mites, molds, etc. Now come to the quick tips of this eye allergy. Try cold, wet compress on the outside of your closed eyelid. You also may find relief if you take an over-the-counter antihistamine orally. If the allergy continues to anyone, you may need to see your eye specialist for a prescription to help you deal with such symptoms. Now, broken blood vessels. Tiny blood vessels in the sclera in white of the eye can break from stinging, litting, rubbing your eyes, or for no reason at all. When this happens, the eye becomes bright red from the blood leaking under the clear conjunctiva that covers the sclera. This is called subconjunctival hemorrhage. A red eye from a subconjunctival hemorrhage looks very scary, but usually it is harmless and ordinarily isn't considered any emergency. Now, quick tip of subconjunctival hemorrhage. To be on the safe side, you should see your eye specialist within a day or two after noticing symptoms to make sure there is no underlying cause for the broken vessels. Otherwise, there really is no treatment other than time for most of these blood leaks. Eye trauma. Getting hit in the eye can certainly cause redness along with pain and blood vision. The eye may be scratched or gouged, but there also could be hidden damage inside the eye, such as detached retina, which can be very serious and must be treated as quick as possible. Unless the hit is very light, an eye specialist should treat eye traumas right away. Quick tips: for some immediate relief, put a very cold compress or ice pack on the injured eye. Avoid rubbing it. If you can't reach your eye specialist, go to an emergency room for urgent care. Now, itching and itchy eyes. Almost all eyes itching is caused by some sort of allergy. Very often, mild itching can be helped with over-the-counter lubricating eye drops. And avoid the ones that take away redness, decongestant, as they can be addictive. You can also use cold compress or ice pack to help with itchy eyes. More severe itching may need extra help, such as oral antihistaminic or prescription eye drops. Although itchy eyes are not an emergency, you still may need to consult your eye specialist for advice or a prescription. If your eyelids are red and inflamed, you could have blepharitis. Make sure you visit your eye specialist to determine the cause and the appropriate treatment. Quick tip: try to avoid rubbing your eyes. Rubbing releases chemicals called histamine that actually make the itchy worse. Now, blood vision. If you have blood visions that happen suddenly and persist, consider this an emergency. See your eye specialist or visit an emergency room urgent care center as quick as possible. If one eye becomes bloody or goes dark suddenly, like a curtain coming down, this is an emergency and should be checked out by your eye specialist or an emergency room or urgent care center. This could indicate a retinal problem like a detachment or even a stroke. If you have some minor blurring that comes and goes, this could be means tiredness, dryness, eye strain. Keep in mind, many eye conditions can cause some blurred vision, including pink eye, allergies, dry eyes, and even lot of near vision work can do this. Most of these are not emergency situation. Quick tips: for mild blurry vision, try testing your eye. If the blurry vision persists, make an appointment for an eye examination. Puff eyes. Unusual puffiness around the eyes often is a sign of an allergy. Of course, trauma such as getting hit in the eye also can cause eyes to swell. Quick tips: if puffy eyes are caused by an allergy, you may have to take an overtime counter decongestant orally to alleviate symptoms. Now, burning eyes. Burning eye can be caused by allergy, dryness, tiredness vision, or stress like computer work, or a combination of all these above. Usually, the burning sensation is not an emergency, but you should see your eye specialist if it is persists. Quick tips in burning sensation: usually eye burning or stinging can be relieved with over-the-counter of lubricating eye drop and rest. Applying cool moist compress over your closed eye also. Now, eye pain. Eye pain can be sharp or dull, internal or external, constant or intermittent, stabbing or throbbing. As a general rule, if you have eye pain along with redness, you should consider this an emergency and either see your eye specialist or go to an emergency room to urgent care center right away. Constant eye pain, especially when moving your eyes or gently pushing your eyes, can sometimes indicate the inflammation of some of the inner parts. This means you should try and see your eye specialist as soon as possible for diagnosis and treatment. I often help people with rheumatoid arthritis, chronic pain through the body or joint, who are having irritated eye pain. Eye pain sometimes is caused by dryness, which needs to be treated with over-the-counter or prescription medication. Occasionally, eye pain is caused by something serious like uveitis. This is an inflammation of the inner eye tissue like the iris. Again, this type of condition should be treated as soon as possible. Eye pain with blurred vision should be considered an emergency and should be investigated as soon as possible by your eye specialist or by the emergency room. Quick tips: if your eye pain is dull like a headache in your eye, but there is no redness or blurred vision, this could be caused of overuse, eye strain, or even sinus problem. I suggest seeing your eye specialist only it doesn't clear up with rest, flashes or floaters. Most spots and floaters are normal. They are caused by bits of protein and other tissue embedded in the clear gel-like material, we call it vitreous, that fills inside the eye. As we age, the vitreous become more fluid and these thread-like strands and shape float more easily within the vitreous, which make them more noticeable. Also, the vitreous separator or detach from its connection to the retina can also cause additional floaters. But some floaters, especially when accompanied by flashes or light, can indicate something serious is happening inside your eye that could cause your retina to detach. As a general rule, if you have a few little dots, thread or bumps that comes and go depending on how tired you are or what kind of lighting you are in, these are normal floaters. But if you suddenly see flashes or light, clouds or floaters, swirling mist or a curtain over part of your vision, it's best to see your eye specialist to go for an emergency room or urgent eye care center as soon as possible. They will dilate your pupil to see what's going on inside your eyes and make sure it gets treated if needed. Most retinal detachment can be helped if treated soon. If retinal detachment are ignored, however, they can lead to loss of vision or even blindness. Quick tips: most vitreous detachment creating spots and floaters just need to be watched, but you have no way of knowing whether you have a vitreous detachment or a far more serious retinal detachment. So, in either case, make sure you see an eye specialist. Last is foreign object, something in the eye. Getting something in your eyes seems like it should be an emergency, and it often is, whether your eye is invaded by a piece of metal, a thorn or a sticker or a sharp object. It is critical that you see an eye specialist in emergency as soon as possible. Don't rub your eyes or attempt to remove wherever is in there. You could cause more damage. Or loosely tape a paper cup. Quick tips: let's also be practical. Not everything that gets your eye is serious. We all have a little bit of something in our eyes at times. If you know it's just a piece of a dust that irritates your eyes, you can try rinsing it with saline solution or using lubricating eye drop. If you are able, try to turning your eyelids inside out to see if you can dislodge the particle. If none of the home remedies work, then it is all up to the doctor or eye specialist. Friends, this is it. Please stay safe, stay healthy. Bye.